Before we dive in today, I want to start by saying our hearts go out to everyone affected by the fires in California. The loss of homes, lives, it's devastating, and it's a reminder of how interconnected our health and our environment really are.
Yeah, absolutely. It's just heartbreaking seeing those images and hearing the stories. And honestly, it kind of makes you think about how unprepared we are for a lot of these crises, you know?
Exactly. And that's part of what we've been building toward in this podcast. In the previous episodes, we talked about focusing on our ultimate goal, health for everyone at the lowest possible cost, and the idea of system stewards, right?
Right? The folks who are supposed to be guiding the whole thing and calling the shots, like the captains of the ship.
Yes, exactly. And now we're moving into what I think is the heart of it. How do we actually change the system itself?
Which I gotta say feels like a pretty massive question to tackle.
It is, but as we'll explore, it's not impossible. There are strategies, frameworks even, that can help us identify where and how to intervene in a system to make meaningful change.
Okay, so we're going from the healthcare stewards to the gears, the cogs in the system, stuff like that? Like the behind-the-scenes action?
Yes, more or less. It's about recognizing where the leverage points are, where small adjustments can lead to big changes. We're going to start unpacking that today.
Perfect. I think my brain's ready for this. Or, well, we'll see. All right, so when you talk about leverage points, are you thinking about those places within the system where even small adjustments can have a ripple effect and lead to major changes?
Sorta. Donella Meadows defines leverage points as places in a system where you can intervene to shift outcomes in a meaningful way. And interestingly, sometimes the smaller, subtler levers can have the biggest impact.
Okay, so not like a giant switch you throw, but maybe like turning a small dial that ends up recalibrating the whole machine? Does that land?
Exactly. It's a great metaphor. Meadows even lays out a whole hierarchy of these leverage points, from the fairly straightforward, like adjusting physical elements of the system, to the really transformative, changing the paradigm or mindset that drives the system itself.
Changing the mindset? That sounds kind of abstract. What does that actually look like in practice?
It is abstract, but incredibly powerful. Think about it like this. If you're trying to reform healthcare, you might start with something concrete, like better funding for primary care clinics, which is great and necessary. But if the overarching mindset of the system still prioritizes treatment over prevention, those clinics will always struggle. Shift the paradigm, redefine success around prevention and wellness, and suddenly everything else starts to realign.
Whoa, that's huge. So the mindset is like the operating software, and if you change that, the hardware follows?
Yes, you're following it perfectly. And Meadows emphasizes this hierarchy for a reason. People tend to focus on making changes at the more tangible levels, like policies, resource allocations, or incentives. But without addressing the deeper levels of paradigms, or even transcending paradigms, you limit the change you can actually achieve.
Okay, so let me ask this. Where do most people or even governments try to push first? What's the most common leverage point they go for?
Typically, it's what she calls parameters, things like budgets, standards, or penalties. It's where we spend most of our time tinkering. But those are often the least effective leverage points because they don't change the structure of the system or its goals. They're like trimming a tree when it's the roots that are the problem.
So, kind of just cosmetic changes, surface level fixes?
Exactly. And this is where Meadows challenges us to think much bigger. She argues that real change happens when you tackle the harder but higher leverage points, like adjusting feedback loops or redesigning the rules of the game itself.
Wait, feedback loops. That's a term I've heard before, but in like tech stuff. Are we talking about the same thing here?
Similar idea. Feedback loops are the self-reinforcing cycles in a system, like when a hospital rewards efficiency, and that efficiency leads to even more rewards. Positive feedback loops can be powerful, but they can also drive systems toward unsustainable extremes if left unchecked. Knowing when to disrupt those loops, or create balancing loops, is key to meaningful intervention.
So, it's about knowing not just where to intervene, but also how to strike a balance. Got it. This is starting to make a lot more sense.
Good. And let's not forget how crucial it is to recognize that systems resist change. A lot of these leverage points are intentionally designed to keep things as they are. Understanding that resistance is part of the work too.
Right? Like trying to move a couch that absolutely does not want to fit through the door frame. It's frustrating, but you gotta adjust your approach.
Exactly. And once you know where to push, the effort becomes much more deliberate and effective.
All right, so talking about adjusting systems and shifting mindsets, Medicare and Medicaid are examples that come to mind. I mean, 1965 was obviously this huge turning point for healthcare, but what I don't get is, how did something that big actually come together? Was it just a rare moment of agreement across the board, or was there something deeper driving it?
Oh, not even close. In fact, it was one of the most contentious debates of the time. You had President Lyndon B. Johnson leading the charge, but it wasn't just him. There were entire grassroots movements, civil rights leaders, and a huge coalition of advocates fighting for this. It was a battle fought on multiple fronts.
Okay, so who are we talking about here?
Well, Johnson, of course, but there's also someone who doesn't get enough credit, Wilbur Mills. He was this powerhouse in Congress, really influential in pushing the legislation forward. And then you had civil rights leaders and everyday citizens who mobilized public opinion. Honestly, it was kind of a perfect storm of advocacy and political skill.
Wait, Wilbur Mills? That's not a name you hear tossed around much.
Exactly. He was crucial, though. He knew how to navigate the political landscape, crafting compromises, pulling in bipartisan support. At the same time, you had people on the ground, ordinary citizens, writing letters, showing up at rallies. All of that pressure added up.
So you've got this big coalition. It's like the Avengers of healthcare reform. But what exactly were they fighting against? Was there just straight-up opposition to helping people get healthcare?
Pretty much. The opposition framed it as socialized medicine, a label that scared a lot of people at the time. The American Medical Association, for instance, was vehemently against it. They were worried about government interference in private practice and what that could mean for physicians.
So it's kind of like what we've seen with more modern healthcare debates. I mean, that socialized medicine label still pops up, doesn't it?
It does, and it's rooted in the same fear that government-led programs will somehow replace or diminish the private sector. Back then, it made things incredibly difficult. But here's where Johnson really made the difference. His political strategy was masterful. He knew how to build alliances and sell the moral urgency of the issue.
So what tipped the scales? Was it just his savvy approach, or was there some big moment that changed everything?
It was a combination. Johnson's skill was definitely part of it, but the moral and economic arguments couldn't be ignored. Think about it. Before Medicare, half of U.S. seniors had no health insurance. Preventable diseases were causing suffering, even death. People couldn't afford basic medical care. It was impossible to justify that level of inequity and suffering.
And I'm guessing the data backed all of this up?
Absolutely. Studies were showing that taking care of people before they got really sick, through preventive care, was actually far cheaper than dealing with massive healthcare bills later on. It made economic sense, and that helped bring people on board who might have otherwise been resistant.
Wow. So what's the, end game? They pass this thing, Medicare and Medicaid, and suddenly everything changes?
Not overnight. But the passage was monumental. It redefined healthcare in America, opening up access to millions of people who were essentially left behind before. It was a foundational shift in how care was financed and delivered.
Which I'm guessing wasn't exactly smooth sailing from there?
Oh no, there were, and still are, plenty of challenges. But the fact that it passed shows what's possible when political will and public advocacy align. It's a reminder that real systemic change doesn't just happen, it's fought for.
All right, so we've talked about how Medicare and Medicaid redefined healthcare access, but it makes me think, what about seatbelts? I mean, they're everywhere now, right? How did something so resisted at first turn into a law that basically everyone follows?
It's definitely a story of persistence and data-driven advocacy. The seeds were actually planted in the 1960s when Ralph Nader wrote his groundbreaking book, Unsafe at Any Speed. He called out the auto industry for neglecting critical safety measures like seatbelts, even though they could clearly save lives.
Wait, seriously? Like they knew seatbelts would save lives but didn't bother including them?
That's right. It wasn't just cost concerns either. Car manufacturers were convinced that pushing seatbelts would make cars seem unsafe to consumers. It's wild to think about now, but there was a lot of resistance, both from the industry and even from the public.
Why the public, though? You'd think people would want safety features.
You'd think, but there was this strong cultural belief, especially in the US, that seatbelts were uncomfortable and unnecessary. People didn't want the government telling them what to do in their own cars. It was seen as an infringement on personal freedom.
Ah, so it's the classic, don't tell me how to drive mentality.
Exactly. It took decades of research and advocacy to change that mindset. The National Highway Traffic Safety Administration, or NHTSA, played a huge role. They started gathering data to prove just how effective seatbelts were at reducing fatalities and injuries.
And I'm guessing those numbers didn't lie.
Not at all. The data was compelling. Lives saved, healthcare costs slashed. But even then, the advocates faced huge barriers. Auto manufacturers lobbied against mandatory seatbelt laws, saying education would be enough, and for a while, states resisted passing laws because they didn't want the political backlash.
So, what finally tipped the scales? Because obviously something changed.
It was a combination of factors. Safety advocates like Ralph Nader and public health experts kept pushing, of course, but there were also local success stories, states that introduced secondary enforcement laws, where you could only get ticketed for not wearing a seatbelt if you were pulled over for something else. It eased people into the idea.
Oh, that's clever. Kind of like sneaking in the vegetables with the main dish.
Exactly. And as those laws took effect, the results were undeniable. Fewer deaths, lower insurance costs. It created a feedback loop. Over time, public opinion shifted, and by the 1990s, most states had adopted mandatory seatbelt laws.
Wow. It's like a total 180 from where they started.
It was. And it's a great example of how systemic change often requires a mix of evidence, persistence, and timing. The advocates didn't just push for laws, they worked to change the cultural mindset too.
And now it feels so normal. I mean, I don't even think about putting on a seatbelt. It's just automatic.
Exactly. But that normalcy was hard-fought. It shows how changing behavior at scale isn't just about mandates. It's about creating a shift in expectations, in what people view as, well, normal.
So, Sophia, speaking of hard-fought battles, everything I've read about grassroots advocacy for HIV/AIDS in the 80s paints a picture of sheer determination. It makes the fight for seatbelts look almost simple by comparison. Can you set the stage for us? What was the world like back then?
It was massive, David. No exaggeration. The early days of the HIV/AIDS epidemic were harrowing. Patients were dying in horrifying numbers, and the responses from the government, media, and even the general public were largely defined by fear, stigma, and inaction. It hit the LGBTQ+ community especially hard, and instead of compassion, what they got was blame.
Yeah, that's awful. I mean, how do you even begin fighting something like that?
That's where the true resilience of the community comes in. People like Larry Kramer and organizations like ACT UP, the AIDS Coalition to Unleash Power, refused to be ignored. They organized protests, staged die-ins, stormed the offices of the FDA and the CDC. They weren't just making noise, they were forcing action.
Die-ins? Wow, I can't even imagine how intense that must have been.
It was incredibly intense. These were people fighting for their own lives and the lives of their loved ones, and they were up against monumental obstacles, societal stigma, political apathy, and a pharmaceutical industry more focused on profits than rapid treatment access.
It's so much. I mean, how do you convince these massive systems to actually pay attention?
By outsmarting them and outlasting them. ACT UP and others didn't just protest, they reframed the narrative. They partnered with researchers like Dr. Anthony Fauci, who became a vital ally within the government, and they worked tirelessly to shift public perception, framing HIV/AIDS as a public health crisis instead of a moral failure. That shift in mindset changed everything.
So this was more than just shouting through megaphones. They had to be strategic, right?
Exactly. They used data, media, and alliances to shame policymakers into action. They argued, persuasively, that this wasn't just a gay men's disease, it was a crisis affecting everyone. And as public outrage grew, it forced the system to reprioritize HIV/AIDS treatment and drug approval processes.
Wait, so the protests, those die-ins and marches, that pressure translated into, actual policy changes?
Absolutely. A big win was getting the FDA to speed up drug approvals. Before, it might have taken years to approve life-saving treatments, but activism cut through that red tape. And while the fight was far from over, those changes saved millions of lives.
It's just inspiring, honestly. People facing such overwhelming odds, and they kept going. They fought for everything.
They did, and their legacy goes beyond HIV/AIDS. They fought for systemic change in how health crises are handled, how marginalized communities are treated, and how activism can light a fire under institutions that refuse to act. It's a powerful reminder of what's possible when people don't back down.
It's amazing to see how people can identify the right moments or methods to create such massive change, like during the HIV/AIDS activism. So let's talk about those leverage points. Are they abstract concepts, or are they practical tools we can actually see and use daily?
Great question, David. And the answer is both. Leverage points can exist anywhere, in your family dynamics, in your community, your workplace, even your local hospital or school. They're the points where small changes can create ripple effects. Think about your family. Maybe changing how you communicate, being more open or supportive, can shift the entire dynamic.
Okay, so it's not just about big systems? It's like zooming in on the moments you actually have some control over.
Exactly. Systems thinking doesn't just apply to big institutions like healthcare or government. It can be personal too. These are the areas where you have influence, and where you can lead change in small but meaningful ways. And here's the thing, even those small shifts, when amplified across families, communities, or workplaces, start to cascade into larger transformations.
All right, but how do we even find these leverage points? Does it boil down to asking, what's one thing I can change that'll make everything else easier?
That's a really insightful way to frame it, David. Absolutely, it's about identifying those key areas where your effort matters most. In systems thinking, it's less about doing everything at once and more about focusing on a few high-impact actions. It's the 80-20 rule in practice.
So in healthcare, for example, you might not overhaul the entire system.
Right?
But you could push for better mental health access in just one community. And that's a start.
Exactly. And you'd be surprised how often those small, focused efforts lead to bigger systemic change over time. In fact, that's something we'll be exploring more in future episodes, how to identify and act on these high leverage points in specific systems. But it starts with awareness and intention. You have to look at the systems we're part of and ask, where can I make a difference?
I think it's encouraging, actually, because it says, even in something as massive as health, there's always an entry point, no matter who you are or where you're starting.
Absolutely, David. And that's the takeaway from today. Everyone has access to leverage points. Some may be small and close to home, others big and system-wide. But change is possible if we know where to push. And as we've seen throughout this series, it's not about doing it all by yourself. Real change happens when individuals, communities, and systems work together.
Which means we're all part of the system, whether we like it or not.
Exactly. But being part of the system also means we have the power to change it. And on that note, I think that's a great place to leave it for today.
Couldn't agree more. Thanks for another insightful conversation, Sophia, and thank you to everyone tuning in. Remember, your leverage points are out there. Go find them.
And that's all for this episode. Let's keep this conversation going. Until next time, take care.